So our topic of discussion today is systemic lupus erythematosus, which is commonly known in short form as lupus. Lupus is a systemic condition which is an autoimmune disorder characterized by inflammation affecting various body systems. It commonly affects joints, the skin, the lungs, the heart, the brain, the blood systems. And usually the signs and symptoms varies among different patients. It's more common among females of the childbearing age, affecting almost 90% of them. It is characterized by various triggers, which include things like smoking, genetic factors. You have viral infections, various drugs that patients might be using, which can trigger the flares. So in the brain, patients will present with mental changes, and there is also aspect of memory loss, and they may also have psychosis. The skin, which is a common organ of presentation, is usually characterized with photosensitivity, and when these patients are exposed to ultraviolet light, they will develop lashes. Then they also have what we call the mala lash, which is a butterfly lash, which will affect the cheeks and the bridge of the nose, sparing the nasolabial folds. Then you have also discoid lashes, which could affect the whole body. And then you have effect on the hair, leading to hair loss. Effects on the heart could lead to heart failure. And then also you can have chest pains. It can also affect the lungs, leading to chest pains. And there is also pruritus with the development of pleural effusion, which is accumulation of fluid in the lining of the lung tissue. The kidneys will lead to what we call lupus nephrosis, leading to protein loss in urine. And then you can also have hypertension, and finally patients might present with overt chronic kidney failure. Usually in the blood system, patients will have abnormal functioning of their white cell count, so they have frequent attacks of infection, which could also be as a result of the drugs used in the treatment of lupus, and they tend to have more risk to blood clots, and then they may also have anemia because due to the chronic inflammatory nature of the disease, leading to anemia of chronic disease. It can also affect the joints, which is also a common presentation. Will also present with joint swelling. The care of patients with lupus usually includes early diagnosis, so that the flares can be controlled and patients can be educated on the triggers. So you need to follow up the patient. You need to follow up for possible kidney failure. There's need for the patients to monitor their weight, and also there is a need for the patients to know about the side effects of the drug they are taking. So patient education is key in the management of lupus and the follow-up to the medication. Then, as I have said, it commonly occurs in females of the childbearing ages, and before these females can conceive, it is good to have good control of the lupus symptoms. So the diagnosis is usually characterized by various lab tests. One of the major tests that we do is a test we call the estimated sedimentation rate, or ESR. Usually, because this is an inflammatory process, the ESR is commonly raised. Then we have what we call the anti-nuclear antibody test, which tests antibodies against nuclei of the cells. Then we have anti-double-stranded DNA, Then you have anti-Smith antibody, you have C-reactive protein or CRP, and all these usually, and then the complement test. Usually, because of the inflammatory nature of the test, you find that the complement factors are reduced in patients with lupus. Then there is also commonly the complete blood count, which represent with possibly low white cell count. They will have anemia of chronic disease. And then for the treatment, we use anti-inflammatory drugs like the NSAIDs, especially to control the flares. You can use drugs like brufen, diclofenac, to control the pain and the inflammation. Then if the condition is not responsive to the NSAIDs, then you can use steroids like prednisone, which will help control the flares. The biggest side effect of the steroid is weight gain. They can also lead to elevation in blood sugar, and of course long-term use of steroids can also lead to bone loss, leading to osteoporosis. Anti-malarial drugs is one of the core drugs in the management of lupus, hydroxychloroquine, and this has effects on the retina. So patients who are on lupus and on hydroxychloroquine, they need to be followed up to make sure that their vision is okay. Then you have immunosuppressive drugs like azathioprine. We have mycophenolate morphine, and also in severe cases we use biologic agents like melimumab. So these are some of the drugs used in the control of lupus flares, and patients need to understand that flares can be caused by excessive exposure to sunlight, so that they need to protect themselves from sunlight by wearing capes with wide edges, and they also avoiding stress, knowing how to deal with stress. Stress can be in various forms, could be emotional, physical, and they also some medications can flare up the lupus effects. So knowing how to deal with it. It's also good for the patients learn to keep persistent exercise. As we have said many times, exercise is very important in the maintenance of the body's vitality, maintenance of the joints, maintenance of the muscle capacity. Then they need to have adequate sleep. They need to have at least 8 hours of sleep. And then monitoring the flares. Usually when the flares are starting, the patients will feel fatigue, they may have low-grade fever, they may have aches in the joints, then sometimes can present with a rash or swelling of the body. So when they notice these symptoms, then they need to seek attention immediately so that they control the flares. So in summary, lupus is a chronic autoimmune disease which is common among females of childbearing age. Early diagnosis is very important, and the follow-up to prevent the flares is important. Patients need to understand the disease. They need to take their drugs as prescribed by the doctor, and they need frequent and consistent follow-up so that complications like kidney failure, heart conditions, lung complications can be monitored and treated on time before it leads to serious complications. Thank you.